am with Dr. Mughisha. He is a specialist in IVF as well as is a consultant gynecologist. And we are very happy to meet our Dr. Mughisha. He is from Uganda. He is very highly experienced in IVF as well as in gynecology treatment. I came to meet him. The purpose of we want to know the doctor's views about biomedical engineering regarding in hospitals, how the importance in the hospitals by the biomedical engineers. Why do we need biomedical engineer in the hospitals? Just we would like to know from our Dr. Mughisha. So what are the views we can listen? This is boost up to the biomedical professionals for their career growth for anybody in biomedical professional. We are coming up, we are joining newly or whoever is there in upcoming engineers also. It will be helpful for them. How the doctors also gives importance to the biomedical engineers in the hospitals, in the companies, in outside, wherever you go there in the world. So just we can have a views. Dr. Mughisha, yes, welcome to our channel.
My pleasure.
So just I would like to ask you that what are the views, means what is your opinion about biomedical engineer importance in the hospitals as per your experience?
As per my experience, I will start by emphasizing first of all that the medical world wouldn't be where it is without biomedical engineers. A lot of innovations, the pacemakers, the prosthetics that we have had, the doctors get a complication and the problem doesn't end as a problem. The problem always has a solution as long as you can dream. And I think the dream has to be from two avenues. One, from the person with the hands-on in the practice, and also the person that can find a solution practically to this. That is generally. But when it comes to the hospital, the biomedical engineers are very, very useful, especially like when it comes to installation. For example, you're going to have equipment that may be a bit difficult to install. And sometimes as you're installing this, you may have a challenge and think that the equipment is not working, or even damage your equipment as you're doing your installation. And after you have installed or you have bought this equipment, you need to test it out. You need to make sure that this equipment is working. And a biomedical engineer is better at this. Also to calibrate. Sometimes you have equipment that needs a bit of calibration that you may not have the technical know-how. Yes, sometimes you may know, but you may not have the technical know-how. When this equipment has broken down, you need somebody to be able to repair this equipment. And this is where the biomedical engineers are going to come in handy. Of course, also for training, people need to be trained how to use some of this equipment. You could be, yes, for example, as a fertility expert, or you're a specialist in fertility and you have been doing, for example, a pickup of an ovum, but using a more manual machine. Now you're having something that is wireless, and so sometimes you need to learn, and there is never an end to learning. And the biomedical engineers usually are going to come in handy when it comes to training. Also, the training for safety, like for example, the biomedical, these engineers may play a very important role, like holding a CME on how to use the MRI room, lest someone is going to move in with metallic stuff, and for our own safety. So the biomedical engineers are useful. And in my own judgment, of course, it may not make financial sense if you're still a small institution or facility. But when you come to a point where you're going to have this, I think it's very, very important that every setting and every hospital at least have a biomedical engineer. Yeah, thank you very much, Mr. Rajendra.
Thank you. Doctor, for newcomers, as a juniors, we are coming to join in the biomedical. So you can advise them to join in the biomedical field.
Oh yes.
For upcoming students.
Yeah, for sure, because you know, right now the field is no longer the strata, the gap between the different professions has really, really narrowed down. And there is a lot of usefulness, there is a lot of need for these people. There is undoubtedly a need for more biomedical engineers. And the problem that most hospitals have is not that the biomedical engineer is somebody very hard to pay. is not that what, because at the end of the day, it's very expensive when you've broken down an MRI machine.
Exactly.
Because of something that would have been avoided
Yes.
if you had somebody that knew these things and knew how to pass on the safety rules and all this.
That's
Yeah, so I think this is a field that is burgeoning, more especially here in Africa, and I can speak for Uganda that not all hospitals have, but yet it is something that would really be useful.
Thank you, engineer, for your views. See the engineers, so doctors also supporting to join newcomers in biomedical engineering field. So all the best for the new upcoming engineers, and if anybody want to become a biomedical engineer, take the biomedical course in your areas, in your countries, in your states, and join in the biomedical engineering department, means biomedical engineering course, and you make your life be proud as a biomedical engineer. Thank you for the watching.